Hello dear patients, today we are going to review the case of Circinary balanoposthitis during chlamydiosis in a man. A young man came to us with superficial erosions on glans penis. They were reddish and slightly itchy. For a long time he had been lubricating them with hormonal triderm cream. They improved a little, however he continued to lubricate them, but erosions remained. In about 5 months it started to bother him, and he thought that maybe it's enough to use triderm, so he came to our clinic. He wanted to do analysis for fungus, and he decided that this is a fungus. Although triderm contains anti-fungal cream that doesn't influence fungus well, it's contained in clotrimazol, so there shouldn't be a fungus in an active stage after the use of such cream. Taking this into account, analyses were taken for fungi. These are 8 candida. This is a culture test from glans penis, however they were negative. Also, analyses were taken for sexually transmitted infections from the surface of glans penis and from inside the canal, as well as bacterial culture test from glans penis. As a result of that, chlamydia were found in this young man. They almost didn't produce any symptoms. There was no burning, but there was a little itch in the mornings that the patient didn't note. There were almost no discharges, that is, there was an asymptomatic carriage of chlamydiosis. Immunoglobulin G, immunoglobulin A were positive. Immunoglobulin M was negative in blood test for chlamydia. This indicates an infection by chlamydiosis that was there a long time ago. The patient was observed and no other characteristic lesions like lesions of joints, Reiter's syndrome, skin lesions, blenorial keratodermia and other lesions were found. You can watch a separate video on our channel about what are skin lesions and other lesions during Reiter's syndrome. So there were no such lesions. Blood analysis was taken for connective tissue disease markers. What it is a topic of separate video. Such analyses are present in some laboratories and the doctor's prescription is required for their correct taking. So these analyses were negative and the patient only had a slightly increased erythrocyte sedimentation rate. A decision was taken to treat chlamydiosis, and considering the chronic course of chlamydiosis, the patient was treated by antibiotics. Canal was washed by Colorgol solution, injections of chymotrypsin, longidasa, enzyme medications were done. Immune medications were administered intravenously by typofosone and polyoxidonium. Gradually in the process of treatment, not straight away, by the end of treatment and after the end of treatment, such erosions gradually resolved without any therapy by ointments. This again indicates that their cause was a mediated immune response on chlamydia, as it happens during joint lesions, for example. What does this case tell us about? It tells us that lesions on glans penis are often not caused by candidosis. Often other causes are responsible for it, and according to my observation, this happens in at least 70% of cases. So, before lubricating anything, it's necessary to do analysis, and if you think that this is a fungus, you have to make sure that this is a fungus, and you shouldn't just use some ointments or fluconazole for treatment of something unknown. If it is necessary to diagnose and treat diseases of glans penis, you can consult dermatovenerologists, urologists and gynecologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such lesions. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.